Listen carefully. Dr. Sara here. These 4 masturbation mistakes are silently destroying erection strength, confidence, and sexual performance in men worldwide. When masturbation becomes excessively frequent, especially multiple times a day, or used as a primary coping mechanism for stress, boredom, or loneliness, it can quietly interfere with the body's natural sexual response system. Urologists explain that erections are not just a physical reaction, but a finely tuned interaction between the brain, hormones, nerves, and blood vessels, all of which rely heavily on balanced dopamine signaling. Dopamine is the brain's motivation and reward chemical, released during sexual stimulation and orgasm, and it plays a critical role in sexual desire and erection strength. When a man overstimulates this system through constant masturbation, the brain begins to adapt by reducing dopamine sensitivity, meaning it takes stronger or more frequent stimulation to feel the same level of arousal. Over time, this can dull sexual excitement, lower libido, and make erections less reliable during real-life intimacy. The brain becomes conditioned to rapid, repetitive stimulation rather than the slower, more emotionally connected arousal that occurs with a partner. As a result, even though blood flow and hormones may initially be normal, the signal from the brain to initiate and sustain an erection becomes weaker. This desensitization can also increase the refractory period, the time needed to recover before achieving another erection, leaving men feeling tired, unresponsive, or frustrated. Many men misinterpret this as aging or permanent erectile dysfunction, when in reality it is often a reversible neurological conditioning issue caused by overuse. Excessive frequency can also impact energy levels and mental focus, as the body diverts resources repeatedly towards sexual release instead of recovery, repair, and hormonal balance. When masturbation is done without moderation, especially late at night, it can disrupt sleep quality, which further lowers testosterone levels and compounds erection problems. Testosterone is essential not only for libido, but also for nitric oxide production, which allows blood vessels in the penis to relax and fill properly. Without sufficient testosterone support, erection quality naturally declines. Urologists emphasize that moderation restores sensitivity, allowing dopamine receptors to reset and the brain to relearn how to respond strongly to natural touch, intimacy, and emotional connection. By reducing frequency and allowing proper recovery time, many men notice improvements in morning erections, desire, confidence, and overall sexual performance. This understanding shifts the conversation away from shame and toward awareness, showing that sexual health is deeply connected to balance, discipline, and respect for the body's natural rhythms rather than constant stimulation. Using an aggressive grip during masturbation is a mistake urologists frequently warn about because it trains the penis and nervous system to respond to an unrealistic level of pressure that real-life intimacy cannot reproduce. The penis is rich in delicate nerve endings and blood vessels that rely on gentle, natural stimulation to function optimally. When excessive force, tight squeezing, or rapid friction is used repeatedly, the nerves begin to adapt defensively by reducing sensitivity. This process, known as desensitization, dulls the signals sent from the penis to the brain, making arousal weaker and erections harder to achieve or maintain during partnered sex. Over time, the brain learns that only intense artificial pressure triggers pleasure, while normal touch feels insufficient. This mismatch can lead to a condition often referred to by urologists as situational erectile dysfunction, where erections are possible during masturbation, but unreliable or absent with a partner. Aggressive grip habits can also interfere with healthy blood flow. Erections depend on smooth blood vessel relaxation and efficient circulation within the penile tissue, but repeated excessive pressure can temporarily restrict blood flow and strain the surrounding tissues. While this may not cause immediate damage, chronic repetition can negatively affect vascular responsiveness, making it harder for the penis to fully engorge when needed. Additionally, harsh techniques may contribute to microtrauma in the skin and underlying tissue, leading to reduced elasticity over time. Elastic tissue is crucial for strong, sustained erections, and when elasticity is compromised, erection quality can decline even in younger men. Another overlooked effect is psychological conditioning. The brain associates pleasure with speed, force, and isolation rather than connection, rhythm, and responsiveness. During real intimacy, the nervous system may struggle to synchronize arousal with emotional closeness, eye contact, and slower stimulation, creating performance anxiety and further weakening erections. Many men assume this issue is hormonal or age-related, but urologists often find that technique-based conditioning plays a significant role. The encouraging reality is that nerve sensitivity and vascular response can improve when aggressive habits are corrected. By adopting gentler stimulation, slowing down, and allowing the nervous system to recalibrate, the brain begins to relearn how to respond to natural touch. This reconditioning supports healthier nerve signaling, improved blood flow, and stronger erections during real encounters. Urologists emphasize that sexual health is not about intensity but responsiveness, and the penis performs best when stimulation respects its natural design rather than forcing it to adapt to extremes. Frequent masturbation combined with heavy porn consumption is one of the most serious warnings urologists give because it fundamentally rewires how the brain responds to sexual stimulation. Pornography delivers an endless stream of novelty, extreme scenarios, and exaggerated visuals that flood the brain with dopamine far beyond what real-life intimacy can provide. Dopamine is responsible for desire, focus, and sexual motivation, but when it is overstimulated repeatedly, the brain adapts by reducing its sensitivity to protect itself. Over time, this means that normal, healthy sexual experiences may no longer trigger sufficient arousal, even when physical health, blood flow, and hormones are technically normal. The brain becomes conditioned to require constant novelty, rapid scene changes, and unrealistic stimulation to achieve excitement, making real partners feel less stimulating by comparison. This is not a failure of attraction or masculinity, but a learned neurological response. Urologists explain that erections begin in the brain long before blood flows to the penis, and when the brain's arousal circuitry is hijacked by porn-driven stimulation, the signal to initiate and maintain an erection weakens. Many men experience this as delayed erections, difficulty staying hard, or complete erectile dysfunction during real encounters, while still being able to perform during porn-based masturbation. This disconnect often leads to confusion, shame, and performance anxiety, which further suppresses arousal by activating stress hormones like cortisol. Cortisol directly interferes with testosterone and nitric oxide production, both of which are essential for strong erections. Another overlooked effect of porn dependency is emotional disconnection. Real intimacy involves subtle cues such as touch, scent, voice, and emotional presence, all of which play a role in natural arousal. Porn conditions the brain to respond only to visual overstimulation, reducing sensitivity to these real-world signals. As a result, the nervous system struggles to stay engaged during partnered sex, leading to mental distraction and erection loss. Urologists emphasize that this is not permanent damage, but a form of neural conditioning that can be reversed with awareness and discipline. Reducing or eliminating porn allows dopamine receptors to recover, restoring the brain's ability to respond to natural stimulation. As sensitivity returns, many men report stronger spontaneous erections, improved desire, and greater emotional connection with their partners. This recovery process also rebuilds confidence, which is a critical but often underestimated factor in erectile function. Understanding the brain's role in sexual health shifts the focus away from quick fixes and toward long-term neurological balance, reminding men that true sexual performance is driven by a healthy mind as much as a healthy body. Ignoring recovery and hormonal balance is a silent but powerful factor that urologists often identify behind declining erection quality and sexual performance. Sexual activity, including masturbation, places real demands on the nervous system, endocrine system, and overall energy reserves of the body. When stimulation happens too frequently without sufficient rest, the body remains in a constant state of depletion rather than renewal. Testosterone, the primary hormone responsible for libido, erection strength, confidence, and vitality, is especially sensitive to sleep quality, stress levels, and recovery time. Chronic overstimulation combined with poor sleep disrupts the natural testosterone production cycle, which peaks during deep sleep. When sleep is shortened or fragmented, testosterone levels can drop significantly, even in younger men, leading to reduced sexual desire and weaker erections. Urologists explain that many men focus only on stimulation while neglecting the recovery phase, not realizing that sexual health is built during rest, not during arousal. Without adequate recovery, the nervous system becomes fatigued, making it harder for the brain to send strong signals to initiate and sustain an erection. This fatigue also affects the parasympathetic nervous system, which is responsible for relaxation and blood vessel dilation in the penis. When the body remains overstimulated or stressed, the sympathetic fight or flight response dominates, restricting blood flow and suppressing erectile function. Hormonal imbalance extends beyond testosterone alone. Elevated stress hormones such as cortisol actively oppose testosterone's effects, reduce nitric oxide availability, and impair blood vessel relaxation. Frequent stimulation without recovery can keep cortisol levels chronically elevated, especially when combined with work stress, poor diet, and lack of exercise. Over time, this hormonal environment creates the perfect conditions for erectile dysfunction to develop gradually and persistently. Many men misinterpret this decline as normal aging, when in reality it is often a recovery deficit. Energy depletion also plays a role, as repeated stimulation drains essential nutrients like zinc and magnesium, which are critical for hormone production, nerve signaling, and muscle relaxation. When these nutrients are not replenished through diet and rest, sexual performance suffers. Urologists emphasize that erections are a sign of overall vitality, not just sexual function. When the body is rested, well-nourished, and hormonally balanced, erections occur more easily and consistently, allowing recovery time between stimulation, prioritizing quality sleep, managing stress, and supporting hormonal health through lifestyle choices can dramatically improve erection quality. This perspective reframes sexual discipline as strength rather than restriction, showing that respecting the body's need for recovery restores confidence, desire, and long-term sexual health far more effectively than constant stimulation ever could.